things that I dealt with as a psychiatric nurse. Okay, so PTSD, I've seen a lot of people with PTSD, but the specific topic that I'm going to talk about is a little bit different. It's a battle that's going on a spiritual level, psychological level, energetic level. And it just recently was addressed in 2012. And they started talking about military sexual trauma. The statistics right now are 1 in 3 women report military sexual trauma. That's just reported. And 1 in 50 men report military sexual trauma.
Too many women.
Men.
Well, and it happens to men too. It's not just a woman thing. And it's not a sexual thing. People think, oh, rape is sexual. No, it's a power thing. It's the perpetrator is having power over the victim. Abusive, right? And it happens far, far too often. And there's kind of a culture in the military that's acceptable. Like the victim is sometimes blamed for the perpetrator's actions. And I'm talking and I'm speaking up because I want the culture to change. I want people to be able to get the help that they need. The way I coped with my own military sexual trauma was to tell myself it didn't happen because it was so horrific that I couldn't wrap my mind around it. And until 2012, when as a nurse at the VA, they started addressing military sexual trauma, then my mind couldn't handle the denial anymore, and I was like, yeah, that happened to me. I started processing it, and I started writing about it as part of my treatment. Well, I couldn't stop writing about it, and I wrote a whole book about it, which I put on Amazon. And I hope that this book helps people who suffered from military sexual trauma and kind of help them put things in perspective and heal. I feel like I'm here at Prescott. I came from the West Los Angeles VA. I worked at the Dom at West Los Angeles VA after many years of working on the floor in psychiatry. And I talked to both men and women who were traumatized in that way. And when I was working through my own trauma, the administration at the VA reacted very similarly to the administration in the Air Force. When I went for help, all of a sudden I became the crazy woman and was booted out. Labeled, right. And that has got to change. I mean, there has to be, from administration, here's a veteran, they're going into treatment, and there needs to be some kind of safety net put into place that it's okay for them to go to treatment. Back in the military, I remember that was a door out. If you go to mental health, you were labeled crazy and booted out. I didn't know it at the time, but that's what happened. So a lot of my talking is to help people deal with this issue, especially for men. I think there's a lot of shame involved, and if they had that kind of experience, they don't talk about it, and it's okay to talk about it and bring it to the surface and start healing. And if you're a perpetrator, even the perpetrators need help. There was some kind of power struggle going on. Maybe they were victims previously, and they're acting out. So there needs to be help put in.
It's easier to just ignore it.
Yes. It's easier to just ignore and say, oh, guys will be guys, or whatever. Yeah, that has to stop, and people need to get the help. So yeah, if you're interested in the book, it's on Amazon.
What's the name of it?
It's called Silence is Violence.
Okay.
Okay? Hashtag #MeToo/military sexual trauma.
Good.
And it's under my name, Heidi Lobstein, but Silence is Violence. And I have 2 copies left with me. So, yeah, if you have any concerns or questions, feel free to talk to me. Like I said, I've been a psych nurse for 30 years, but to deal with my own trauma was an entirely different thing. And I appreciate you listening to me. I really appreciate it.
Thank you.
Thank you.
Author!
Okay, I had another one.
Yes.